Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Manju Prasad MK. He is an Indo-US company medical director and also the personality development coach. And his research has been enormous. Whatever the old and golden rules of Ayurveda, he has tried to prove it with research and show to the modern generation how innovative wellness solutions can be given to the wrong habits that the people are having. And hence, he has written a comprehensive handbook on Patya Apatya, what is good, what is not good, and that is a guide to the patients. And why this is important is today the people are taking wrong combination and then getting into the chronic idiopathic diseases, and nobody can find out. It is not due to the infection, it is not due to the thing. Then inflammation is occurring. Why the cause is not known. And such unknown causes are because of the wrong food habits. And today, wherever we go, we see people eating all sorts of things, stuffing themselves with the wrong food and with the wrong combination. So today we are going to have Dr. Manju Prasad, who has recently written a success mantra, a guide to the success. And hence, let us welcome Manju Prasad. Namaskar.
Thank you, ma'am. Namaste, ma'am. Thank you.
Yeah, you being an excellent Ayurvedic person, tell us why the younger generation are aping at the West and eating wrong combinations and getting into trouble. So you please tell us what is this wrong combination? Which food should not be mixed? You please tell us.
Sure, ma'am. As you rightly started, ma'am, the idiopathic cause, the idiopathic factors influencing the diseases. Day to day, we all come across in our OPDs, in our hospital and clinics. There are a number of conditions which we don't know about a cause. Maybe psoriatic conditions, arthritic condition, IBS, or any other factor, skin issues, allergy issues. Earlier, the person doesn't have any family history too. Initially, he himself says, initially I was good, sir. I was good 2 years back. I don't know why it's happening. But if you go in detail about the principle, what searching the principles of Ayurveda, then we'll get a concept named Viruddhahara. It can be called as incompatible food. The food or improper combinations of food. This can also be taken as one of the source for a causative factor of such conditions. And as you said, properly said, today's generation, Indian young generation is falling beyond the Western.
Yes.
Yeah, they're more forward. They're falling more forward to Westernization. They're combining Western, Eastern, Southern, Northern, all parts of all sort of what cultures, all sort of foods, all sort of
Cocktail
combination.
of
We can
food.
also see
Cocktail of food. Yeah.
cocktails. Yes, rightly said, ma'am. Cocktail of food, and we also know present Gen Z generation always follows trend. Whether that doesn't know, does that want to feel whether it's good or bad, whether it's right or wrong. Just the trend is going on. We'll go 40, 50 kilometers away from city to have a biryani in morning 4 a.m. Who will eat biryani at 4 a.m. in the morning or 5 a.m. in the morning? But it's a trend especially in Bangalore and Vasur Road. It's a big trend. And also eating jamun with masala dosa or eating Maggie with cooked. Even it feels weird to explain such things. But to be sad, it's a
Maggie is
present.
cooked with Maggie itself is bad,
Coke.
and that is Coke,
Maggie itself is
Coca-Cola.
cooked with
See,
Coke.
Coke
Maggie itself
itself
is
is
cooked
bad, and Maggie is still worse.
with
And combining that is a still double
Coke.
worse. Okay,
Yes.
yeah.
For us, even it explain it also feel weird, but to be sadly said, the present generation is going for that. So as I said, these
And
can be
I have
positive
seen,
factors.
in the airport, they stuff with all sorts of junk food. And on top of that, they have the fizzy drinks,
Fermented.
the ice cold
Yes.
from the fridge they would have got. And what
Yes.
combinations, it is so weird.
Yes, ma'am.
Okay.
Yes. What is the present Gen Zs or the present young generations options of choice should be always be like we can question with respect to health scales. Coming back to the topic, as we can trace out, the food can be a good cause. A food can be a good cause for health. Food can be also a very good cause for disease as well.
Ill health
So
also. Yes.
yeah, ill health also. So we'll explore the concept called Viruddha Ahara, incompatible food. This incompatible food doesn't mean only bad combination. It can also it involves the preparation, wrongful preparation, also wrongful intake or misintake. We can say that the food, if you if you mix or if you combine the food of two opposite natures, then it can become incompatible food. If a
For
person who
example,
doesn't have,
mm,
for example, if you can say simple example, mixing sweet, if just start, we can also feel ourselves having junk food and eating milk. Definitely,
mm,
the child will feel nauseatic. The child will
mm,
feel bloating, right?
okay,
We won't at that moment, a parent or child will not get to know that because of this, because I ate chips or I ate a deep fried item and later I consumed milk. But deep down, if we come across that, always the best example for bad combination is mixing sweet items with sour items. Example is milkshakes. The present trending example is milkshakes. The present trending examples also can be taken as fruit salads. Fruits, all fruits are prepared or tapered with creamy materials, creamy substances, or dairy substances. That can also be good examples, as well as a bad example for food intake. So
okay,
coming for incompatible food, this can be taken in 4 or 5 ways. One combination, as I said, improper combination of or mixing of two substances,
okay,
improper intake. So if we can,
okay,
even if I'm feeling not good, even if I know my appetite is low, but I like that food, if I take more, that will also become incompatible. Then improper processing. If I
mm,
eat or take the food which has been fried in a repeated fried oil, then also become a visha or poison in our body. And
yes,
also the seasonal
and that
variance. If
leads
you are
to
in hot season,
oxidation and
summer season,
atherosclerosis and
uh,
heart attack later on. So that
yeah,
is
it also
the
cause
oil
all
which is
vascular
heated
disorder.
repeatedly, it gets oxidized, and that becomes a very dangerous food, you know. We
Causing
call it
tissue
as a
damages,
trans fat
cellular
also. Yes,
damage.
yes.
Yeah. Yes, ma'am. What is trans fat is a good example. And in the same way, similar to trans fat, Ayurveda has quoted the word Garavisha. We call
Mm,
Visha, poison.
mm,
Garavisha means
mm,
slow poison. The
mm.
intake of such substance will not immediately affect us, but
But
deep
in the
down
long
on a
term, it will
chronic
cause the,
term,
yes, agreed.
definitely the person has to pay for that. Ayurveda
Yes,
has explained so many concepts. Combine taking consideration of a time to a small time duration, we'll only discuss on the combinations of Samyoga Viruddha, Kala Viruddha, or Samskara Viruddha. Like Samskara means processing, Kala means with respect to time, morning, evening, night, Matra, or also it can be appropriate quantity, and of course Samyoga, as I said. Example, how these things will change our body. For a few examples, taking heavy meals during night hours, it's also cause incompatible. Even if you take good meals, it's compatible. Taking fruits, of course, fruits are good. We always ask patients to eat fruits. But taking fruits directly next up, soon after having food, will cause fermentation. Will cause fermentation and ends up in bloating. And also, in the same time, mixing, as we initially discussed, mixing or intake of coffee, tea, or fermented drinks along with food, that also diminish the digestive factor, causing
digestion. Yes,
inflammations, improper microbes, gut microbes disorders, and ending up with other autoimmune conditions because of
okay,
diminished immunity power.
okay.
Similarly, if we can come up with the slow or like what can be the observed symptoms, like short term, we can categorize as short term symptoms and long term
And
symptoms.
a long term.
Short term, of
Okay.
course, long term. Short term, the present symptoms will be bloating of
Mm.
stomach and indigestion, or we
And
can say
nausea.
heaviness, fatigue,
Mm, mm.
nauseatic, of course,
And
nauseatic, or like
flatulence.
of course,
And
got
flatulence and the
migraine.
gas. Okay.
Yes.
Mm,
This can be short-term symptoms, but
mm.
unfortunately, the person will fail to identify such things. Even if they have blotting or flatulence or indigestion, what conditions, they doesn't trace back to the food they into. Because these combinations are trending, this combination energetic, these combinations are like some social influencing things they enjoy. So in the meantime, so deep down they forget to trace back the causative factor for all those
Yes,
conditions. They think it's a
yes,
normal
yes.
for them. The flatulence is a normal, as I said, gastritis is normal, but it's definitely not a normal. Back then, if
And
you
that's
go
why,
in
you know,
detail,
nowadays everybody is saying gastric, gastric, gastric. You ask
gastric.
anyone, they say, oh, I have got gastric. And then gastric is a stomach. So what has done to the stomach and what has happened, they are not thinking of it. Yes. Yeah.
Yes. And that the forthcoming problems also they are neglecting. They're only thinking
Correct.
gastritis is a common condition. And also back then, what I observed I've been working with oncological department also. I got in Bharat Cancer Hospitals. And one thing we shocked is the ovarian cancer initial symptoms will be gastritis itself. Sometimes
Yeah,
failed.
bloating sensation, distension. Yeah.
Exactly.
Yeah.
Yes. Huh? So long term, what can be the long term? Long term, as I said, it can be a good reason for all autoimmune disorders. We can talk about psoriatic conditions, arthritic conditions, or allergic,
And
unexplained allergies.
even the heart diseases, heart attacks,
Heart is definitely heart disease. As I said, oxidative stress gets induced in
atherosclerosis,
the
and the
body.
blood vessels will be damaged.
Blood vessels
Okay.
damaged. And
Mm.
also we can also trace back the condition next level, like impotency also can be good reason. Oligospermia,
Oh,
it's all because of all this has been proven
wrong
also,
food
ma'am.
habits.
Such combination
Oh.
will also, yes. So
Mm.
why unexplained infertility? Like if we go through that, we can also trace back such conditions. And it's true also, like whenever we take wrong foods, definitely it will disturb diminish the digestive system in the stomach, inactivating or disturbing the functions of enzymes. If you go to intestine, definitely it will disturb microbial environment, causing the
Okay.
dysbiosis. At the end,
Okay.
at the
Yeah.
end, yes,
Mm.
ma'am, please, ma'am.
Mm.
Uh,
Yeah. What I
at the
was
end,
trying. Yeah. At the end.
diminishing the immune system, either the
Yeah.
patient will be more prone for opportunistic infection or he will be hypersensitive and are ending
Okay.
at allergic or other conditions. These are
Okay.
the common problems leading to
So
serious health conditions.
now I'll ask you rapid fire questions and then you tell
Yes,
which
ma'am.
is good or bad. So
Sure,
drinking
ma'am.
buttermilk at the end of the food, it's good. Drinking buttermilk after a meal is good. But
It's
drinking
a good,
Coca-Cola yeah. Drinking Coca-Cola, Pepsi or fizzy drinks with the food
good. It's good. Drinking
or
for it's
Coca-Cola,
bad,
Pepsi, cold drinks is
bad,
bad.
wrong,
Okay, bad, not to take.
bad.
And eating banana after
Then
meal,
coffee also bad.
bad. Okay. Eating banana
Banana
at
is
the end
yes,
is good. But eating fruit salad
bad,
with mixed with all sorts of
bad.
fruits is not good.
It's bad,
Okay. Yeah.
bad.
Okay. And eating, drinking milk is good. But drinking milkshake is
It's
not.
bad.
Okay.
Good.
So people should realize that let us go back to our ancient method, what our mother, grandmothers used to tell, and then follow that habit so that our health will be better and we don't get into these long-term chronic diseases which are autoimmune diseases. So thank you very much, Dr. Manju Prasad. In our next episode, we will discuss more about these food habits. Thank you.
Sure, ma'am. Thank you. Thank you very much. At the end of the video, I would like our audience to just follow, respect their digestive capacity, and avoid improper combinations. Thank you, ma'am.
Thank you. Thank you so much.